If you're already on Medicare and you think you can just set it and forget it, this video is going to change how you think about your coverage. So in part one of the series, we covered the three enrollment periods that matter the most when you're first becoming eligible: the initial enrollment period, the general enrollment period, and the special enrollment periods. So if you haven't seen that one yet, the link is in the description below. I'd head over there right after this video. So today we're covering the two enrollment periods that matter most once you're already on Medicare: the annual enrollment period and the Medicare Advantage open enrollment period. So I'm going to explain why one of the biggest mistakes people make on Medicare is really assuming that their plan is the same as it was last year, because it almost never is. So let's start with the annual enrollment period, also called the AEP, or sometimes open enrollment, you'll hear people say. So the AEP runs every year from October 15th through December 7th. During this window, anyone on Medicare can make changes to their drug coverage or their Medicare Advantage plan. Those changes take effect January 1st of the following year. So here's what you can actually do during the AEP. You can switch from original Medicare to a Medicare Advantage plan. You can switch from Medicare Advantage back to original Medicare. You can switch from one Medicare Advantage plan to a different one. You can join the standalone Part D drug plan if you don't already have one. You can switch from one Part D drug plan to a different one, and you can drop a Part D drug plan entirely, though I would be careful with that one because of the late enrollment penalty implications that you could have for life. So the AEP is the main annual enrollment window that most Medicare beneficiaries have to review and change their coverage. So it's not the only window. We covered special enrollment periods in part one, but for the majority of people on Medicare, this is the moment that matters most each year. So here's the section of this video I really want people to pay attention to, whether you've been on Medicare for 1 year or 15 years. Medicare Advantage plans and Part D drug plans are not fixed products. They are renegotiated and restructured every single year. So what your plan looks like in January may not look the same, and it may look completely different by the following January, and the only way to know that is to review it every AEP. I'm talking about every single piece of the plan. Premiums can change, deductibles can change, copays, coinsurance, benefits, the doctors and specialists in your network can change, the pharmacies in your network can change. The formulary, that's the list of covered drugs, that can change as well. Drugs that were in a low-cost tier may move to a higher cost tier. Prior authorizations, requirements can change. And yes, a plan that have a $0 premium last year may actually have a premium this year. So I see this constantly. Someone has been on the same Medicare Advantage plan for 4 or 5 years. They're happy with it. They've never had a problem. Maybe they're pretty healthy. So when October rolls around and they get their annual notice of change in the mail, and that's the letter that every plan is required to send before AEP, they toss it in the pile with the rest of the Medicare mail without even reading it. Then January rolls around. Now their doctor is no longer a network, or their medications went from a $35 copay to a $95 copay, or the dental benefit they've been using got cut in half. And now they're stuck with that plan until the next AEP because they didn't make a change when they had the window. So here's what I want you to take away from this. Being content with your plan is not the reason to skip the review. It might still be the best plan for you. And if it is, that's great. You keep it, you move on. But you need to verify that every single year instead of just assuming, because the plan that was perfect for you in 2024 might not be the right fit in 2025. Same with 2026 and 2027. So it has nothing to do with anything you did. The plan just changed. Not all of us like change. I get that. But if the plan's changing around you, whether you like it or not, the best thing you can do is stay ahead of that. So the annual notice of change letter that comes in the mail every fall, read it, every word of it. And that document tells you exactly what is changing on your plan effective January 1st. So if something is changing that affects you, your doctor, your drugs, your premium, your benefits, that is your signal to shop during AEP. Now, the flip side of that is also true. Just because it is AEP does not mean you should just automatically switch. I've seen people switch plans every single year, chasing the lowest premium or the flashiest benefit package, and then they end up with a plan that has a more narrow network or worse drug coverage or a higher max out of pocket than the one they left in the first place. So the goal during AEP is not to switch. The goal is to review. You review your current plan against your current needs. You look at what's changing. You check whether your doctors are still in network. You run your prescriptions through the plan's formulary to see what they'll cost you next year. You compare that against other plans available in your area. And then you make a decision based on your actual situation, not because someone sent you a mailer or a television commercial told you to call before December 7th. So switching is the right move when your plan is no longer serving you well. Staying is the right move when your plan is still the best option after a real comparison. So the point is really to make that call intentionally, not by default. Now, the second enrollment period we're covering today is the Medicare Advantage Open Enrollment Period, otherwise called OEP. So the OEP runs January 1st through March 31st every year. It's a more limited window than the AEP, and it only applies to people who are already enrolled in a Medicare Advantage plan. Here's what you can do during the OEP. If you're in a Medicare Advantage plan and you still want out, you can switch to Original Medicare and join a standalone Part D drug plan. Or if you're in one Medicare Advantage plan, and you want to switch to a different one, you can do that too. Here's what you cannot do during the OEP. You cannot use it to switch from Original Medicare to a Medicare Advantage plan. That direction only goes through AEP or a special enrollment period. And you cannot use it to make standalone Part D drug plan changes if you're on Original Medicare rather than a Medicare Advantage plan. Think of the OEP as a second chance window for Medicare Advantage enrollees who made a decision during AEP, or maybe lack thereof, and then realized in January or February that the plan isn't working the way that you expected. Maybe the new plan's network turned out to be, again, more narrow than you thought, and maybe you had a formulary issue with the drug you need. The OEP gives you a limited opportunity to course correct before you're locked in for the full year. So, one important thing to know, if you use OEP to switch from a Medicare Advantage plan back to Original Medicare, you may want to look into a Medigap supplemental policy to help cover drug costs that Original Medicare doesn't pay. Obviously, that's not necessary if you have something like Medicaid, but depending on when you're reading this and what state you're in, getting into a Medigap plan after you've already been on Medicare Advantage may require some medical underwriting, meaning you could be declined or charged more based on your health, but that's a topic for its own video, which I will make, but it's something to factor into the decision before you make a move. So let's bring all this together. The annual enrollment period runs October 15th through December 7th every single year. During this window, anyone on Medicare can review and change their drug coverage, their Medicare Advantage plan. Changes take effect January 1st. Every single year during AEP, review your plan, not because you have to switch, but because your plan may have already changed on you without you realizing it. So premiums, deductibles, copays, benefits, networks, drug formularies, any of it can shift from one year to the next. So read your annual notice of change when it arrives, compare your current plan against your current needs, and then make that intentional decision. The Medicare Advantage Open Enrollment Period runs January 1st through March 31st, and it's a limited window for people already in a Medicare Advantage plan to switch to a different Medicare Advantage plan or move back to Original Medicare. So together with the periods we covered in the Part 1, the IEP, GEP, and SEPs, these 5 windows are the complete picture of essentially when and how you can make a Medicare enrollment decision, and knowing all 5 means you're never caught off guard. Now, if this 2-part series helped you, I'd really appreciate if you like this video and subscribe to the channel so you don't miss what's coming next. And drop a comment below if this helped you, or if you just liked my T-Rex taco shirt, wanted to spice things up a bit. So this video is for educational purposes only. I have 8 years of experience in the Medicare industry. This is not personalized advice, and just please consult a licensed professional for guidance specific to your situation. Follow for more Medicare education, and I'll see you guys in the next one.